Health Talk. How's that? Pretty good, Kristin?
Perfect. I'm so excited to be back here.
She says, I've missed you all so
I really
much.
I really have.
You were around normal people for so long, you just forgot
and then
what
I returned to this.
Yeah,
Right.
you forgot what it's like to be around weird people. So there you go.
We help you feel better about yourself, right? You got a little bit more self-confidence.
And when you leave here, I get to go back to my real job of being a doctor.
I feel so much more sane now.
All right. So first of all, this is a regular guest from Community Medical Center. We are thrilled to have her because you're fun. Because you talk about slurping and slopping. We talked about remember that we talked about the sunscreen?
And that was a pleasure. And I hope how are you doing with that?
I don't ever get out in the sun, so it doesn't matter.
Sure. So we can check you for vitamin D here shortly.
I have been using my little app for the solar screen.
Oh, good. All right.
Although, if you try to use the app and you're not in service, you could have a problem of hanging out in the sun way too long thinking it's safe, and it's not.
Yep.
Yeah, so
good to bring that up.
Consider that.
All right. So we are here today to talk about staying active, and summer's on the wane.
Yeah.
But we still have the Olympics are going on. So whenever little kids see the swimmers and the and the gymnastics and all that kind of, they're out there doing the the stuff they're imitating, which is a very good thing, right?
Absolutely. Well, I thought I'd start out with one of my favorite topics, which is to ask you all questions. You always get 100%. You're the A+ group here.
Right. Where's the buzzer?
So here we go.
Okay.
What is the recommended amount of physical activity that adults should have
a day
per week? Per week.
Okay.
Let's see. I'm thinking 4 hours a day, so 7 times 4. We're going with 28 hours.
28 hours?
Oh, yeah.
Of exercise?
Of exercise. Well, are we talking about just like walking? Is that considered exercise by you folks? Or is it like pumping iron?
You folks. You crazy
you guys,
people.
whoever comes up with these statistics. Yeah.
Well, I am generally impressed. Again, I think you ate 28 pounds of fruits and vegetables every week, and you get 28 hours of exercise. Wow. You do not need any of the folks, as it says, but for the rest of the mortals.
For me.
Do you have a guess? How many?
I'm going to guess probably about 10 to 12 hours per week.
Again, rock stars in here. You're absolute rock stars. You do not need that much, so maybe that's the good news.
Okay.
Well, let me rephrase that. More is always better. Any physical activity is good, but about 2.5 hours a week of moderate intensity exercise.
Really?
And you get some health benefits.
Seriously? 2 to 4 hours? What a wimpy amount.
Yeah, that's I might as well just sign up for that spaceship in WALL-E for 2.5 hours. I mean, it's like walking.
You can do it. You can do it.
I've been reading a book called Younger Next Year. Okay.
Sure.
I'm a member,
I see that.
I'm a member at the Peak. Okay.
What do you mean you could see that?
Because I'm old.
Right.
And it's primarily for people over the age of 50, of which I certainly am.
Not next year.
That's almost times 2. But anyway, it recommends, quite seriously, it recommends, on the opening page, he writes, my friend and I, the actual doctor who helped him write the book, we could have written this book in one sentence.
Right.
And its sentence is exercise 6 days a week and stop eating crap. But
I love that.
But in order to sell some books, we kind of had to flesh it out a little bit.
Why didn't we think of this?
So his deal is that the older you get, the more you should be exercising to battle, the natural decay that. Laugh now, John. The natural decay that begins to happen when you become older, right?
Well, right. We're all aging at the same rate, and physical activity has all kinds of benefits. Ranging from managing weight to the effects of that diabetes, hypertension, cholesterol, all of those things that, you want to try to prevent. Physical activity helps you. Now, you can't outrun bad nutrition. So, like you said, you can't eat a bunch of
crap.
Thank you. I'm glad my boss doesn't have to hear me say that on air.
I'll say it.
I'm so grateful to you.
Yes,
There's scientific words for it, but we won't go there.
We won't even go there either.
You want the GI people
no,
to talk about that.
The scientific word is Cheetos.
Correct.
Okay, go ahead.
So you do need to eat the 28 pounds of fruits and vegetables that you'll be eating. But if you break it down, 30 minutes, 5 days a week, this is doable. But I do hear a lot, people don't have time for it. So, what are some of the ways that you can make time for it? I think that's one of the questions. And the way I recommend people look at it is just as important as brushing your teeth. You have to do it. Is that what you want to do? Would you rather eat Cheetos instead of brushing your teeth? Probably. But, once you do it, you feel so much better.
You really do.
Yeah.
And that is the one thing that I've discovered, because my wife and I try to go to the gym at least 3 to 4 times a week now.
Yep.
And so she runs, and I've discovered I really like the rowing machine.
Okay.
So I'm rowing for like a half an hour, 45 minutes.
Perfect.
And then we go to the weight room and throw up. No, we go to the weight room and just try to pump some iron and just get the blood circulating.
And that's really important, and it helps your bones.
Yeah,
actually, it's really important to
when you
fix
get done,
that in.
when you get done and you're driving home, you're all pooped out. But about a half an hour later, you get this rush. Wow, I feel really good now.
Right.
So.
And I think the other thing too, I don't know about how it impacts you, but I think it changes the choices you make the rest of the day. If you do exercise, or you're going to exercise tomorrow morning, you're probably not going to reach for some of those foods because you think, oh, I've already done something right, and I'm getting a skeptical look.
Well, I try to balance the yin yang.
Oh, sure. So, I knew that was
I worked
coming.
out today.
I shouldn't have even
Balance
gone
out the
there.
good work with a Snickers bar.
Well, I'm going to reward myself with this lovely 4-pound Snickers bar.
Right. So I would caution those to be realistic about the snacks that you have.
Now, I have to ask you, so when I think about working out, I mean, it can be a big spectrum of stuff.
Absolutely.
Right? And it's
That's the other thing.
And the intensity could be very different, like pumping iron, as Peter was doing, or rowing, like political candidates might do. Or if you've ever seen House of Cards, you'll get the joke. Or just walking. So there's a big spectrum, and they can't all be considered equal, are they?
Shaking
They
hands,
aren't.
kissing babies, all sorts of stuff.
Yeah.
Sorry.
You're absolutely right. So that you can choose if you want to do 2.5 hours a week of moderate activity. So those are the things that you're talking about: walking, even housework, yard work. These things count. So count them in. Take that into account. Feel good about yourself. If you went out and worked in the yard pretty vigorously for a while, you've gotten some exercise in. So you've improved your physical activity. Now, if you are more about efficiency, then you don't have to do quite as much time for exercise, and the recommendations are more vigorous activity for 75 minutes total a week. So if you're into more bang for your buck, do the rowing, do the running.
We're up against a break. By the way, Dr. Anderson is here to answer your questions. We have 4 lines open, maybe 4.5 lines. I'm not sure. 721-1290 is our number, and we'd love to visit with you. We haven't even really talked about the Olympics yet, about the things that we can learn from. You look at those athletes; they are amazing.
They really are.
But they didn't just naturally pop up that way.
Right.
They had to work their tails off to get where they are.
And if they're from Russia, they had drugs.
Yeah. And they didn't get to come this year.
Well, they did. They let them back in.
Some.
We'll
be right back. And we are back on Health Talk. Yeah. Okay.
It is.
Kristin's going, wow, I like the music. Yeah, we can exercise.
Feel like we should
today.
go exercise. That's exactly right.
Okay, let's talk about the Olympic Games now. As we sit in our chair,
Right.
You're right. Just
the irony
with all of the surrounded by snacks, and look at these amazing athletes. What can we learn from them?
Well, one of the things
First
that
of all,
was
they're all like 5 years old.
Actually, one of the swimmers from the Brazil team, I believe it was Brazil, they call him Junior. It's his first Olympics, and he's 30.
Wow.
There you go.
Well, did you watch swimming last night?
Yes.
And did you see Corey Miller? I thought that was so inspirational. Corey Miller, he was one of the swimmers, and I can't remember the event. I knew you'd ask me, but they did a talk about how he had pectus excavatum. Does anybody know what that is?
It sounds like a spell from Harry Potter.
Here we go. Yeah. So it's when your sternum actually kind of sinks inward. Yeah. And he was diagnosed with this as a kid. And it
so it's
can,
like a sunken chest.
yeah.
Thing?
So and sometimes you'll see this, and it's people have this, and it's okay. It's one of those things. Sometimes it can get so severe that it compresses the heart and vasculature and impact things from that direction. And what he was talking about is a doctor told him, that swimming might help. It will broaden your shoulders, increase your lung volume. It really might be something. And He placed third yesterday.
Wow.
Yeah, bronze medalist. So I think that is one of those things where if you are feeling like you can't quite do it or you're just too tired, I mean, think about all these things that you can absolutely overcome and improve your health.
I noticed one of these swimmers was also a graduate of med school. How did that make you feel? I was like, I haven't done med school or been in the Olympics. I'm feeling really behind here.
Well, these people work so hard. It's so amazing, and it's great to see them.
So we got a question for you from Katie.
Sure.
She says, what do you think of intermittent fasting as a health strategy?
You know, I would say anything that you can do to improve your health is something that you'd recommend to, you know, your family or your friends or your kids if you have them. So I would say not so much. I don't see how, I mean, other than sleeping, technically you're fasting while you're asleep.
Just eat constantly throughout the day and night.
Some of us who don't sleep at all. But anyway, go ahead.
I don't think that that's probably your most successful strategy. I think, you know, I think we've talked about dietary guidelines before, but focusing on the fruits and vegetables that you need to eat, the protein, the dairy, 3 meals, some snacks, those are okay. I don't think that you need to stress yourself, and your body doesn't need to be stressed like that. I don't think you're going to gain any real benefit from that.
I mean, isn't exercise stressing my body? I mean, why does it work in one case but not the other?
In a good way, though.
In a good way,
yeah,
right.
Yeah.
You're strengthening those muscles. Your heart is a muscle like anything else. That's different than stress from deprivation, I would say.
The only way you could make a muscle grow is to stress it.
That's right.
Right?
That's right.
Yeah.
Yep.
So,
A little bit of stress is good. A lot of stress is bad.
Yeah. Now, I wanted to ask you specifically about people who are, morbidly obese, who look at the Olympics and they just despair because I'll never be able to do that. I could barely get up out of my chair. So let's start at home here.
Right.
What can I do if I know I'm overweight, and if you are?
Right.
What can I do at home without having to go to a gym or be embarrassed or whatever? Can I just find some stairs?
Yeah.
What can I do?
You can just any kind of movement. Just like I was talking about, housework, yard work. Those are things that you should celebrate and be proud of. Another really good tip is that physical activity, at least at 10 minutes at a time, will have some health benefits. So you do not need to be Katie Ledecky to be a healthy person. You just need to, for 10 minutes at a time, go for a walk. It may be walking out to your mailbox. If you have a mailbox that's way out from where your house is, walk out there, walk back a couple times. That is going to get you started. You're going to start to feel better. The other thing that I would suggest is, some of these kids, if you watch it, they have, since they were 6 or, 10 or whatever, they've dreamt about winning a gold medal. So they have a goal. And I would suggest that if you're thinking about this, if you're contemplating it, what's your goal? What do you want to do it for? And it's not so that you're in a certain, I hope, your goal isn't to be in a certain size of clothing or something like that. It should be, do you want to run around with your kids or your grandkids and you can't do it? Is your obesity keeping you from hiking the M? Set a small step, a small goal that, over the course of the next 1 or 2 weeks, you can manage so that you can be proud of that and then increase your goal next time.
Not only that, but you will find if you reach out to people, you will find there's an amazing community out there of people who want to help you because they're right there in that same boat with you. So why not get this thing done together and support each other. The worst thing you can do is do stuff alone, right?
Right, absolutely. And like you said, some people are just not quite ready to do that. But if you find some people that are in the same boat, they're going to encourage you. They're going to say, it's 50 degrees out. It's perfect. It's sunny. Let's go before it gets hot.
Right.
To have somebody to rely on, you can't beat it. So find an exercise buddy. 10 minutes, even 10 minutes helps you.
So a lot of people feel like they have their lives planned out. They go to work.
Yeah.
They come home. They make dinner. They do chores. They go to bed. They go to work.
Yeah.
And so it's kind of hard to find the time for people to get that 2.5 hours. Are there things they could be doing throughout the day, you think, that might be able to log their time in?
Break it down. I mean, unless you're you, and it's 28 hours a week.
Exactly.
So the rest of us.
Treadmill with weights.
So that's good for you. But the rest of us, maybe you could shorten your lunch hour by, 15 minutes, get 15 minutes in 5 days a week. And then on the weekend, maybe take a longer walk with the dog. You've met those really laudable goals. And so try to work it in. Again, I use the toothbrush analogy. You magically find time to brush your teeth. this isn't a lot longer. If you need to start 10 minutes at a time, you can do this. It is creative. I would say the other thing is make time for yourself. You've made time for everybody else along the day. I think you can make some time for yourself too.
All right, we're going to come right back. 721-1290 is our number, 1-800-568-5309. We're, believe it or not, folks, summer is going to end sometime soon. So if you want to start getting into shape, why not start building some of those habits, right? Because
That's
it
absolutely right.
takes 21 days, from what I understand.
To break a habit. But move your socks around. See how long it takes you to keep looking for your... Guess we'll have to talk about that at the break.
Okay, well, we'll come back on that. I'm a little freaked out now.
Taking my socks off right now.
We'll be right back. Okay, we are back. Believe it or not, just a few minutes left in our program of Health Talk. Talking with Dr. Kristin Anderson. And in the midst of all the fun and games and laughing and joking, there's some pretty serious stuff going on here, right?
Right. I mean, I think you really need to take into account is physical activity and health important to you? And what are those goals? What matters? You're not going to win a gold medal probably next week, but you need to think about, walking with you. What is it that you want to do that you can't do? Set that goal and then work to there.
I wanted to ask you if there are very many links between obesity and mental health.
Well, physical activity has been shown to reduce depression. So even if you reduce it, the other thing that I think is an important message to bring up is even if you reduce your body weight from a high level of obesity to a lower level, you've still gained health benefits, even if you're moving to a healthier weight all the time. So the main message is anything that you can do is better than nothing. Any improvement, even 10% of your body weight, is going to improve your health outcomes. So it just get started, just do something. And when you brought up the shorter days, I mean, they're coming. People are more prone to depression at that stage. So if you have a routine now, you know how it feels, you're happy with it, you're more likely to continue that, and it will sustain you through the winter a little bit better.
I have a friend that I've challenged who was used to be morbidly obese, and I challenged this person. I said, look, why don't you and I get together and we will walk the 1 mile fun run next year
perfect.
at the Riverbank run.
Right.
And they're working on it. They're going to see if they can get this done. And perhaps even better, how about the Missoula Marathon has a 5K?
Anything.
And you don't have to run it. You can walk it. I mean, it's
anything. Just anything. And, we're so lucky in this town. I think we've talked about this before. We don't have it. You're safe to go out in most places and most times a day in Missoula. You can go out and do that. But there are plenty of places where it's not safe for you or kids to go out on the street.
Right.
There are places where there are no sidewalks. I mean, let's be serious about it. We are so lucky. We're filled with parks and trails and, to various places. So
now you can walk from downtown Missoula all the way to Hamilton and back.
Yeah, it's unbelievable.
Right? Yeah, so anyway.
Unbelievable.
All right. So we have a minute left in the show. So give us some contact information if we want to get involved in this and get in touch with you.
Right. So one other thought that I had, if you do have a chronic disease or you have any symptoms, I do want to point out, really important to talk to your doc about it. Generally, they're going to talk to you about your history. So contact Community Medical Center, communitymed.org, or call the main number, and they'll be happy to hook you up with a primary care physician if you don't have one, or if you have some questions about getting started, your doc is a perfect person to talk to.
You bet. Okay.
We have a call?
We have less than 30 seconds. Sorry. So is there a number to reach you? Because you're
728-4100. Yep, main number, and just give a call. And like I said, your primary care doc is a perfect touchstone to talk to about these things. And like I said, watch the Olympics, get inspired about something, pick a goal, and go from there.
Just go watch Rocky 10 or 12 times.
Or listen to the music.
There you go.
I montage every morning.
All right. I'm glad to hear that. We don't want to know any more about that at all. Okay. Thank you, Dr. Anderson.
Thank you.
It's a pleasure. We're going to come right back and have open phones on Talk Back. Stay with us.